And a warm welcome to you from Geneva, Switzerland. I'm Rida Sadki from the Geneva Learning Foundation. I'm here, of course, with Charlotte Mbou, also from the foundation in Ebola, Cameroon. This is a coordination call, really, for partners and then for guests of honor at Teach to Reach. Who are partners? We're hoping that you'll be hearing firsthand from them. They'll be introducing themselves, and we'll be taking them through the partnership process, really how they can get the most out of their partnership of being a Teach to Reach partner. And the same with our guests of honor. Guests of honor are those who've taken the time to respond to one or more what we call Teach to Reach questions. And because you share your experience, we want to honor you, and we're doing that today to help you prepare and think about how to get the most out of Teach to Reach. And then 1 week from today, then that is when we'll be actually going out for the big event. I'm going to ask Charlotte if perhaps she can bring partners into the panel that we know should be there. Should be here. Otherwise, please raise your hand so we can, if we don't identify you right away, we're going to tell you about the great partners that we have for Teach to Reach. I wanted to start, though, by asking Charlotte to read at least, and this will take a few minutes, to read the part of the manifesto starting with, let me just bring this up. Starting with who are we and where do we work? And this is a manifesto. Version 1 was presented at Teach to Reach 8. Version 2, 1,000. So version 2 was developed using inputs from over 1,300 health professionals from all over the world. And version 2 will be formally presented next Friday. But we wanted to do a reading of it, and it'll take a few minutes, but we would ask you to listen to every word and to think about the following questions. Let me see. As you listen to the manifesto, please ask not just what you think, but how does it make you feel? Do you feel it represents your experience? What else would you want this manifesto to say and why? How can we improve it? And who are we speaking to in this manifesto? So Charlotte, over to you, and let me know if you need more time or or you have any issues. I'm hoping the connectivity enables everyone to hear you.
I hope so too, Reda. I think I'm ready. So you said I should read the whole manifesto or just the who we are and where we work?
Let's do who we are and where we work, and then what motivates us to work in global health, and then we'll pause after that.
Okay, so who are we and where? While many of us have trained as health workers, we also come from other professional backgrounds, teachers, social workers, and technicians. Some of us are volunteers. We receive little or no payment for carrying out health work in our communities. We come from all levels of health systems and are aware of the strengths and limitations of these large and complex organizations and the critical role of political direction and leadership in making these systems work. Some of us lead big teams at national or regional level. Others are responsible for specific areas of work within a local facility or across several facilities. Many of us work with poor communities. For some of the people we work with, healthcare above economic activity to survive. The communities we work with may be geographically hard to reach, suspicious of government and by extension us, or hold religious or cultural beliefs that do not easily adopt the science we base our work on. Some of us highlight how decisions about housing, sanitation, and education affect the health of the communities we serve. But decisions on these things are made without reference to population's health needs. COVID-19 has, for many of us, highlighted the fragility of the systems we work in and our relationships with communities. For some of us, it has meant more investment and renewed political focus on healthcare. For others, it has meant cuts in key budgets and the rise in new threats to our work, such as rumors spread by social media. Many of us remember the fear of the early days of the pandemic and losing colleagues and friends, and often carried out our work without adequate protective equipment. For some of us, this period confirmed why we signed up to work in health. For others, this period was a source of mental stress and anxiety. Each of us is working in a unique context. The nuances of community structures, culture, and religion interact with the structures, image, and resourcing of our own health systems. To be successful, we must make this interface work. Those of us who work in humanitarian contexts report further dimensions of complexity in our work. Our security is often not guaranteed. The facilities and equipment that we rely on may be targeted and destroyed or displaced. What motivates us to work in global health? Many of us describe growing up in communities with limited access to health workers and experiencing the avoidable death of family members and friends at young ages as a factor that motivated us to become health workers. The sense of serving our communities is strong and is the sense of the importance of our roles and the respect that they can engender among community members. For some of us, health work is seen as a stable career that allows us to support families, and a few of us are being recruited to fill gaps in European health systems. Yet for others, pay is irregular and promises of payment are broken. Fortunately, money is not our only motivation. We speak of the feeling of success when a child is reached and cured. We describe being motivated through involvement in decisions that affect us, through the recognition of our leaders as well as community members, and through the ongoing support of partners who want to support our communities to be healthy.
Thank you, Charlotte. This is the first part of the Manifesto 2.0 that will be presented at Teach to Reach. And many of the folks who are here as our guests of honor for Teach to Reach 9 are amongst the 1,300, I think it is now, whose contributions were inputs into drafting this manifesto. 15th of September, we held a consultation with around 390 participants to give further inputs. And so what we'll present next Friday will be an updated version with those inputs. And we'll be inviting all, we don't know the exact number yet, but probably around 18,000 Teach to Reach 9 participants to make also their contribution by sharing their experience. So for partners who've joined us, as well as our guides on the side, this is the kind of thing that happens through this continuous learning experience that is Teach to Reach. Before getting into the practical aspects, which is the main purpose of this call, I want to thank our guides on the side, partners, and contributors who have shared some amazing quotes. Let me go to the ones in English. Quotes from Kate O'Brien and Ephraim Lumengo, who lead the vaccination at WHO and UNICEF. Teach to Reach is proof that immunization professionals are hungry to learn and hungry to share. Equally important in our view is the contribution of Nabwagamo Habiba, who's a community health worker for the Ministry of Health in Mukono District, Namasub County, Uganda. I don't know if Habiba is here. If so, we'd love to hear from her. Said, Teach to Reach has helped me learn to monitor and advocate for timely delivery of vaccines for children in my community. Similarly, we have Laura Shimp, who's the director of the Immunization Center at JSI, who'll be one of our guides on the side next Friday. She said she wrote to us to say she'll be late. This is a very busy Friday for her. Who said, I'm joining Teach to Reach 9 because it is so critical to learn with immunization service providers on their real-world experiences in reaching population with vaccination. But now Laura also has very specific questions that she's interested in, such as in the context of a discussion we'll be having on HPV vaccine uptake. She wants to learn how you are working with cancer prevention groups, gynecologists, schools, community groups to increase HPV vaccine uptake, particularly with out-of-school girls. So that's just a little bit of the framing of what we're feeling 7 days away from Teach to Reach. we're now going to, before we dig into the practical aspects of partners, you've heard the manifesto, you've seen some of the quotes. We thought that for partners who are joining, especially those joining who will be joining Teach to Reach for the first time, it'd be good to hear from some of the contributors, those we consider, what was we call them, our guests of honor. Charlotte, would you like to invite one person to answer? So both what challenge, what do you expect from Teach to Reach 9, and what challenge do you need help with? How do you think Teach to Reach can help you? We've discussed in our sneak preview, we actually asked you one specific idea that you learned at Teach to Reach. If you've come up with another one that you'd like to share, that is fine too. Charlotte, who shall we go to now?
Already, I'm inviting Kamran Khan. Kamran, are you able to unmute yourself? Okay, I see you're already unmuted, and please do start by introducing yourself. Kamran?
Yes.
We know it is late evening in Pakistan, so we especially appreciate you joining, hopefully from home. Can you introduce yourself and tell us how many sessions of Teach to Reach you've joined, and what do you expect next Friday?
Okay, my name is Kamran Khan, Dr. Kamran Khan. I have done MPH and Doctor of Pharmacy. I have around 7 years of experience in immunization program in Pakistan, Khyber Pakhtunkhwa, working with a UNICEF third-party consultant in Peshawar in many districts. So I expect many things learning from Teach to Reach 9. And the one important thing currently in Pakistan, HPV vaccine is not added in routine immunization, and the government along with the partner are trying to add and launch the HPV vaccine soon. So it will be so Teach to Reach forum will be a very good forum for me to learn from the colleague where HPV vaccine is started and they are administering it to their people, how they launched the campaign, what were the issues, what are the outcome. So I am interested and expected to learn about HPV vaccine as government of Pakistan is starting to launch it soon. So this will be a good forum for me.
Thank you, Kamran Khan. I have one more question for you. You could, of course, there are very good, high-quality guidelines from the World Health Organization, from other immunization partners around HPV vaccination. What is different when you hear something from a colleague who may be halfway across the world from you, but who shares their experience of what worked in practice, what they did in practice to successfully carry out working with a community for HPV vaccination, for example?
Yes, I have a public health specialist, I think from Kenya. Her name is Pinia, something like that. He shared his experience about HPV. And the one important thing which I have learned from his story, which he have shared and write it on Teach to Read, that for HPV vaccine, they placed a vaccination registered inside the school where girls are coming and they were vaccinating and registering their those girls. So this was one of the one very important or new thing which I have learned about HPV. Like if we started in Pakistan, so if I may be the part of this HPV, so I will share with the policy or at the management level that it should be replicated in Pakistan. Like in school, this vaccination register should be placed, and those girls who have administered vaccine should be recorded in that register. That is a very good record for other government.
Thank you, Kamran Khan. One last question. Have you been to Kenya? Have you ever visited? And would you like to visit? Has this contact with a peer from Kenya made you want to visit?
No. I have learned it through Teach to Read session. So she shared her experience or a written form of success story, which I read in Teach to Read website or these sessions.
All right, great. Yeah. Okay, thank you. So let's now turn to, I know we have, well, there were several people with hands raised. I know we could spend the entire session sharing, even 1 week before Teach to Reach, sharing experience already. But the point here today is to actually provide a practical briefing for partners, guides on the side, and guests of honor. So I'd like, and the way we're going to do it is we're going to ask two of our Teach to Reach partners, Jessica Hawley from the Gavi Zero Dose Learning Hub and Nicole Vecchio, to ask, basically to tell us what their questions are at this point about Teach to Reach 9. We have been, we are going to share the exact, I think we have now by now, shared the exact time slots, but we'd really like to take the time to answer the questions that you may have. I suggest we start with Nicole from Bridges to Development. Bridges to Development will be doing a session on contributing to a session around neglected needs of women's health on female genital schistosomiasis, ahead of what we call the Impact Accelerator that we're running, the Geneva Learning Foundation, the End Fund, and led by Bridges to Development. Nicole, a warm welcome to you. I believe it is early in the morning for you. Would love to hear what your questions ahead of this session that will be taking place next Friday. What questions do you have as a partner of Teach to Reach that we can try to answer here?
Hi, Retta. Sure. I did not have a chance to see the exact timings email that was sent. Not sure if it was sent during the night here, but so for when, I guess, Julie will be speaking at the Teach to Reach event on female genital schistosomiasis, and I'm wondering at what time she'll be called upon to speak, and will she be doing a PowerPoint presentation?
Yes, the perfect question. Thank you. So two parts to my answer. First of all, we've now published a full schedule for Teach to Reach, so that's what I'm putting in the chat. And then I've shared the quick guide for partners. Now we are inviting Julie Jacobson, who's one of the founders of Bridges to Development, not as a speaker, but as a listener, and what we call a guide on the side. So the exact time slot, Charlotte, I believe is 4 p.m. Geneva time. So that's the easy part to answer. I'm going to ask Charlotte to actually take up the hard part, which is just to summarize what is a guide on the side and what will we be actually asking Julie Jacobson and other partners to do, where they're usually, because they tend to be global experts, are invited to speak, present, and share their expertise in a presentation format.
Thank you very much, Reda. So a guide on the side is usually for us, we say crudely, is the opposite of the sage on the stage. So we invite global experts or partners, subject matter experts, people with knowledge on specific topics to come and sit and listen to frontline health workers, those who are implementing interventions and probably global guidelines on the field, and also having from time to time adapting those guidelines to their local context. Listen to them share their experiences of what is working, what is not working in their context, for them to meet up with their objectives. It could be in any domain. It could be in immunization, reaching zero dose. It could also work very well in female genital schistosomiasis. So it's really sitting down to listen and asking questions to get more specific, get the practitioners, the professionals more specific, sharing details about their activities, their interventions, and giving them concrete advice on what has worked elsewhere, or maybe available guidelines that could help them do their work better. So that is in a few words who a guide on the side is. And we didn't, just to say, rather conclude by saying Teach to Reach is a learning platform, a peer-to-peer learning platform where experience sharing is at the heart of the learning. People count on the collective intelligence of peers from different health system levels, different organizations, different countries to improve or to learn what they can do to overcome their main challenges as far as different themes are concerned. Thank you, Rena.
Thanks, Charlotte. Yes, Nicole, is that, does that leave you with more questions and answers, or is that a helpful response?
No, that's helpful. So we will just be prepared to like provide links to kind of the helpful materials and things like that, and just be watching.
Yeah, resources are great, but what we most need from our guides on the side is to really be in listening mode and think about how can I help this person, just like if you were visiting them in their in their facility, in their district, sitting side by side with them, breaking bread, sharing a meal, and they tell you, I have this challenge, and you're there thinking, how can I help this person? What can I do? What is within reach? I'd like to turn to Oren Levine, who's going to be for the first time our guide on the side at Teach to Reach. Now he has a history, to say the least, with Teach to Reach, but I love this quote, joining with the Teach to Reach community is like a chance to get a giant serving of education from the front lines of immunization. Oren, I know it's also early morning for you. I hope you're able to unmute and tell us, provide some context for that quote, what your expectations are, and what questions you have as a first-time guide on the side.
Sure.
And do introduce yourself first.
Hi, I don't know. Can you guys hear me?
Loud and clear.
Okay, great. Sorry, Red. I'm in Baltimore today. Hi, everyone. I don't know how much guiding I can do. I'm really interested in learning. Like, I just think what an incredible community you've built here of Teach to Reach. Just watching the people coming in through chat, their experience. Every day trying to work to kind of improve immunization. So I'm going into the next call with just like ears wide open, mind wide open, trying to kind of learn from the participants. And I'm sure that during that, conversation, I'm going to get some mix of kind of curiosity and inspiration, and I'll just take it from there and follow up with folks. But that's what I'm really looking forward to.
Great. Thank you. Thank you very much indeed, Oren. Let me go now to François Gass, who's been along for the ride with the Geneva Learning Foundation, has participated in many Teach to Reaches, bringing his the depth of his experience and expertise. François, what would you like to share with Oren, with Nicole, with Jessica, with new partners who are joining Teach to Reach about what to expect and how you see your role? What can you do when there are literally thousands of immunization and other health professionals connecting with each other, learning from each other?
Thank you, Reda, and hi to everyone present today. I think, I'm going, like Robin say, I've based all my experiences of learning from people in the field, and with the chance to have traveled in a lot of countries at different level, learning from practitioners in the field, their problem, their challenge, and sharing when I traveled to other countries who didn't have this chance to be shared with the experience of their colleague and share when I travel again. This time, I think it's an open platform where everybody can share their experience, the challenge, the specificity of the challenge, how they address the challenge, why do they succeed, what was their critical success factor, what if they fail, why they fail, what was the challenge, because in fact, we are individuals, and there are many individuals in the world today that will share the same challenge. Some have resolved it, some are looking for some solutions, and this is a platform that can do that. Maybe my suggestion is really to be as specific as possible, to be as useful as possible. We are sometimes not enough specific. So make sure that when you share an experience, when you ask a question, you are extremely specific. And in the questions and in the answer, because then it becomes extremely useful. And I think this time we'll have people at health facility level who are directly in front of the children they have to vaccinate, in front of the challenge to reach communities. We have people at district level, at national level. So you will find some experience that may match the challenge, and you can share your challenge, share your success. So I think it's a unique platform to do that never existed before. So I'm looking forward to learn more. And maybe I will, if I have a chance, if I'm not clear enough, I will ask my question. We're just pushing for specificity.
All right. Inevitably, François, we're going to turn to some of our guests of honor who've contributed ahead of Teach to Reach and ask them what they expect from guides on the side. Before we go to Jessica Hawley from the Gavi Zero Dose Learning Hub and from JSI, I want to go back to Oren with one question. People will be sharing stories, experiences, and we've heard over successive Teach to Reach sessions how they are then changing what they do, how they do it, and getting results that they were not getting before. But we still get the response occasionally with decreasing frequency. This is just a bunch of stories. At best, it's anecdotal evidence. In taking time to, in coming to spend time with us here, I was wondering how would you respond to that? Who says, well, it's just a bunch of people swapping stories. They seem to be excited about it. But what difference does it make?
Well, first of all, I would say I'm a big fan of stories. I think we all learn from stories. I think stories alone sometimes have limits, but stories together with evidence often are the kind of things that really influence and change the way people go about taking action and solving problems. So I'd be open to the stories. I'd also love to hear from participants where they think stories have been helpful and where they think stories were not enough. And they needed something else to try and kind of bring about the change that they were looking for.
Yep. Thanks, Oren. All right, let's now go to Jessica Hawley, and then we'll have also Charles Kakere from UNICEF. Jessica Hawley today represents the Gavi Zero Dose Learning Hub. Jessica, please do introduce yourself and tell us, as a Teach to Reach partner, what are your expectations, but also more practically, what are the questions that you have at this stage?
Thank you, Rita. Good morning, good afternoon, good evening, everyone. As Rita said, my name is Jessica Hawley. I'm a communications advisor with the Gavi Zero Dose Learning Hub, and we're really honored to have a role in the Teach to Reach session next week. And it's been really exciting and inspiring to hear from veteran Teach to Reach attendees on what they're hoping to get out of the session as well. Also on the call today, I'm joined by my colleague Elena, who will actually be leading the presentation on behalf of the Gavi Zero Dose Learning Hub next week. And I'm afraid I just have very technical, logistical questions this morning and nothing
Those are great
exciting
too.
Or inspirational to share. So Elena is also chatting me off to the side as well. So we're trying to collate our questions. First off, we were just curious about the run of show for next week and what our speakers should expect the day of, including do they need to log in early to test their audio and visual, and who will be projecting the slides on their behalf, etc. So hopefully, could you just walk us through each stage of the presentation, and so we can capture a run of show for next week?
All right. Thanks, Jessica. So we have some tutorials and really step-by-step guides, and then if needed, we can provide additional support. It's true that what everyone knows is Zoom, but we do have with us, I believe, Valerie, who has been working on, let me just see, yes, working on completing the guidance so we can send it off to you. Valerie, would you like to summarize very briefly yes, what Jessica should expect in terms of the process? How different is it from Zoom, I guess, is what everyone is likely to be asking, and how reassuring can you be that you'll be providing the support and guidance that she needs?
Sure, Reda. So we are working on a guide, a step-to-step partnerships guide that will help you, and also attendance guide to help the speakers with the logistical aspect. So the platform we are going to use is Hopin, and we are going to share a tutorial that shows you how to share your screen, how to share your audio and your microphone and your video, how to join the stage, how to join the panel, and it's very simple and direct to the point. And I'm confident that that will actually help us to acquaint ourselves with the Hopin platform. It's a bit different from Zoom, but I'm sure that it's not so difficult to use. After a short while, it's really easy to learn the ropes, and the guides will really be a great guide for us. Thank you.
Thanks, Valerie. And would you be available to help Jessica and her colleagues and anyone else who needs that support ahead of Teach to Reach to say jump on the call and quickly walk them through the specifics, the specific steps?
Yes, absolutely.
Okay, wonderful. Thank you.
Absolutely. We are on standby to provide any support. Yes.
All right, great. Now I would like to go to so we'll try to give a quick demo, but we may not have time today, which is why I'm suggesting a quick follow-up call, or once you've had a look at the documentation. But sometimes 5 minutes with a human can beat even the most comprehensive, specific and easy to use documentation. I'd like to turn to Charles Kakaire from UNICEF. And this will be for the main plenary session. UNICEF has been our partner for Teach to Reach since Teach to Reach 6, I believe. So I'm really hoping that he's able to unmute. Yes, all right. A warm welcome, Charles. Yes, so tell us. You tell us what is your expectation from Teach to Reach, the plenary session. The theme is very specific. It's identifying and reaching zero-dose children with vaccines in urban and peri-urban areas. So can you tell us a little bit about this session, what your expectations are, and then tell us any practical questions you have as a partner, even though you are a Teach to Reach veteran guide on the side?
Thanks, Reda. Thanks, colleagues. Good afternoon. Good morning. Basically, as Charlotte did mention, I look at Teach to Reach as a frontline health worker platform, and because of exactly what it is, I am looking forward to hearing from the colleagues on the front line with regards to the challenges and opportunities that they are with regards to increasing immunization within urban settings. We know for sure from the data that when we're talking about zero-dose children, one of the contexts where the zero-dose children are is urban informal settlements, which is sort of what led us to identifying this topic as one of the areas of discussion. We would like to be able to hear from those on the front line what their experience is with regards to immunization within urban context. What are the challenges? What are the opportunities? What are some of the unique things that we can leverage on, or piggyback on to ensure that we support and build up, immunization of children within this given context? Given that, we know for sure again that urban provides very unique challenges, both from, infrastructure challenges and challenges to the cosmopolitan nature of people living urban. So I'm really looking forward, myself and colleagues from UNICEF and the colleagues from the Urban Working Group will be looking forward to hearing from those on the front line what they see as the challenges, the opportunities, and what it is that we can work on to ensure that we support immunization in this context. Thank you.
Thank you so much, Charles. We really want to thank you, the UNICEF team, and then, of course, Ephraim Lomengo for your continuing support to Teach to Reach participants. Now, I do want to ask a question to our guests of honor, but for the sake of time, I'm going to answer it, and it's actually on the slide. What happens before Teach to Reach? So many people think the live event, that's where the learning happens. I would say that in most cases, there may be significant learning, but most of the learning that matters happens either before Teach to Reach, in response to what we call Teach to Reach questions, or after, as participants reflect on what they learn and begin to think about, how am I going to put this into practice? And then we'll ask you that question at the next Teach to Reach. So Charlotte, could you explain what is a Teach to Reach question? I'm showing an example here on screen, and this is what we sent out to all, at the time, I think it was 17,000 Teach to Reach participants, asking them if they work in an urban area to answer a number of questions. Can you tell us how that works?
Yes, rather in line with what you just said, that learning, tissue rich learning actually begins before, during, and after. So what happens before is we send out questions based on the key themes, topics that have been pre-selected by participants at previous tissue rich events. So we send out those questions to gather their experiences. What are they doing as far as, for instance, Charles just talked about reaching zero dose in urban and peri-urban settings. So we asked them, how are they? Do they have those communities, informal communities in their context? Have they identified zero dose children among those? Do they have data to back up that? So they share all of these experiences, and our insights team at the Geneva Learning Foundation, we get to peruse the responses to those questions to produce just hundreds of slides with all of these insights that are captured and given back to the knowledge producers, that is the frontline health workers, to say, this is what we got. And Teach to Reach, the main event itself, we will just get to listen to a few out of these hundreds of experiences that have been shared. But meanwhile, the richness of the data, the information is given back in the form of slide decks, in the form of newsletters, in the form of recordings, reports to the larger community. So that is in a few words, Reda.
Thanks very much, Charlotte. Yeah, that's great. So I have a follow-up question for Charles, though. At UNICEF HQ, obviously, there are information networks information data coming in from countries. And this is a tough question, Charles. What do you expect to learn from experience sharing, this kind of learning, this kind of continuous learning process, that you may not get, that you're not as likely to get by the more conventional means and tools that you have available at across UNICEF?
Thanks, Reda. But again, as I did mention, we're going to hear from those on the front line. It's one thing reading guides and reading guidance around how to work in urban, but it's another thing hearing from people who are working in that context. So really hearing from them in terms of what their experience is, what works, especially if we're thinking about what is it that works when it comes to, planning, implementing, and or evaluating, immunization programs within an urban setting. I know that, quite a number of colleagues that will be on the, on the session would be either working directly within such context or have had experience one way or another, dealing with clients or caregivers from such context. So really, Teach to Reach 9 is going to give us an opportunity to hear live from the colleagues who are on the front line, to be able to see how we can then utilize that information, build onto it, again, in terms of building an evidence base around what works.
Thanks very much, Charles. Now, we have less than 10 minutes left for the partner call, so I really do want to dedicate the remaining minutes to specific questions that we're able to either answer right away or follow up on, to make sure partners leave this, partners and guides on the side, leave this this briefing with either everything they need or with follow-up to make sure that they get that as quickly as possible. So turning back to Nicole, Jessica, and Charles, do you have any further questions? You should be able to unmute yourself if you do. And then the same actually for the guides on the side. If you have further questions, we'd love to hear from you. We're going to switch at around the 45-minute mark to preparing the live stream. So we'll do. We realize it's a big commitment, especially on the Friday afternoon or Friday evening if you're in the Asian part of the world. And so we want to make sure to make the best use. So at the 45-minute mark, we'll start preparing a short live stream to really announce this has been private. It's been recorded, but private. We'll do a live stream shared on Facebook, Twitter, YouTube, LinkedIn. I think it even goes out on Twitch. Yes, and that's one of the ways that we have to promote. And Yes, so if there are no further questions, then I will turn back to Kingsley Okwegume, who's had his hand raised for a while. And yes, we'll definitely share these resources in a follow-up email after this briefing so you can peruse them at your own leisure. We try to condense and distill the instructions, but the more questions we get, then we go back and iterate. So Kingsley, or if there are others, Charlotte, before we close, if you'd like to say, and actually we do have that specific question, what do you expect and what would you like from partners, Teach to Reach partners, and guides on the side? What are your expectations? How can they be most helpful to you? Would love to ask, for example, Julie Abatani or Kamisha Shaw Kelly, Kaiser Parviz, Kifle Dimo, let's see, Mariati Ramat. It's quite late, Mariati in Indonesia, I believe, if I'm not mistaken. Masena Buakia. Just to hear from you directly, what are your expectations with respect to the guides on the side and these great Teach to Reach partners that are making time to contribute next week, just as you are as practitioners? Charlotte, I'm going to turn back to you also to see if there's anybody that you know has been reaching out to you to speak. All right, and just
no, whether no.
All right, so just want to acknowledge also the quality of the contributions in the chat. I'd like to turn to Professor Becky Tagbo from Nigeria. Becky, would love to hear from you. What do you expect from a guide on the side and from our esteemed partners? And please do introduce
exciting.
yourself. Yes.
Can you hear me?
Yes, we can, but do introduce yourself.
Oh, I'm Professor Becky, working in Nigeria. I'm joining from Nigeria, and I've been a member of Geneva Learning Foundation since March last year. I don't think I have missed anything.
I confirm. Yes. And what happened in March last year, just so we understand, what led you to join?
Yeah, I just saw the link. I can't even remember who shared it with me, but somehow I saw the link somewhere and I clicked, and that was it.
All right.
That was it. I couldn't leave, even though it's so tight for me. Nevertheless, I always squeeze out. Sometimes I'm double tasking or multitasking, but I just make sure I join. Yeah. And I've learned a lot. Really, it has taught me that learning is more effective when it is practical, when it is informal, when it is experiential, and when it is peer generated, as against theoretical by sages on the stage. This is really what Teach to Reach is all about, and I'm looking forward to this one again.
So, Becky, what would you say to Oren Levine and Laura Shimp, who's just who's been able to join us, and thank you for joining, and then also so they will be our guides on the side. And what would you say to Jessica Hawley or Nicole Vecchio from Bridges to Development or from the Gavi Zero Dose Learning Hub? How can they be most helpful to you and other practitioners? In order to make really the best of Teach to Reach for them as partners and guides on the side, and for you as practitioners and guests of honor next Friday?
Yeah, I want to thank them for joining us. And I think one major thing they can do for us is active listening, and then bringing in their wealth of knowledge and experience in tackling the challenges so raised as they listen. Thank you.
All right, wonderful. Thank you. All right, we're going to shift gears now to the live stream. So we invite guides on the side and partners to stay on if you're able to. So we're going to spend maybe 15, 20 minutes starting at the top of the hour to introduce, really, we do this reveal of the final schedule, or near final, I should say, schedule for Teach to Reach. We're especially excited because there are topics this time out, outside of the realm of immunization, such as neglected needs of women's health and specific NTDs, FGS, as well as for the first time we'll be discussing climate change and health at Teach to Reach 9. So we'll be starting with that. In terms of the prep, I'm going to we're going to go to you both. So to all three groups, so partners who are able to stay, guides on the side who are able and willing to stay, and guests of honor who are able and willing to stay for the live stream to take on these questions. What challenge do you need help with? What do you expect from Teach to Reach 9? So we can identify before we go live 2 or 3 people who will kick off, and then the rest will be like a jazz improvisation ensemble, not a classical music orchestra. Charlotte, over to you while I do the setup and just close down this private recorded session.